plan year starting August 1st, 2016, and it will end July 31st of 2017. And just so you all know, everyone's going to be in mute mode. Please write down any questions that you may have and hold on to them until the end of the presentation. And then what you can do is put them, write them into the chat box. You'll see that in the GoToMeeting box that you should have on your screen. And then you can send those to me and I will go over those. I'll repeat the question and then I'll go through the responses. Okay, we have some items on our agenda today. The first, we'll talk about open enrollment. So what is it? Why are we here today talking about our benefits and what open enrollment actually means to you? We will help you understand your benefit plan options. And then I'll answer any questions, of course. And then we'll talk about next steps. So what you'll need to do from here in order to enroll or make your elections for August 1st effective date. Open enrollment is an annual period when you, the employee, are able to update your knowledge of the healthcare industry, of course, ask questions about the benefit plans. You'll select the plans in which you want to enroll, or this is your opportunity to change your family election. So not only are you able to select a different plan at this time, you're also able to change your family election. This is the only time that you can do this throughout the entire plan year unless you have a qualifying event. A qualifying event would be a marriage, divorce, birth of a child. So if you had one of those situations, you could then make a change to your plan elections, but you would have 30 days to do it from the date of your qualifying event. So always keep that in mind. If you know you have some family changes coming up, just know that you'll need to make any changes that are necessary within 30 days of the event. Let's talk about what's new for 2016. The existing HealthKeepers 20-2500, so that's the $500 deductible plan, and the Value Advantage 32,030 plan are renewing as is. We are removing the Key Care PPO. We did not have much enrollment in there, and we wanted to put in another option so that we have a full product offering that includes a $2,000 deductible plan, a $1,000 deductible plan, and a $500 deductible plan. So now you have a full suite of options that are available to you and can decide what best fits your needs from both a financial as well as a benefit standpoint. Just so you're aware, Anthem has put in a few mandatory benefit changes to all the plans. These are really just going to apply to prescription drugs. So you have a 90-day maintenance medication. You can now purchase 90-day maintenance medications at a local retail pharmacy for 3 times the retail copayment. Keep in mind, you still have the mail order option that is, you're going to save money on a mail order scenario, but if you're someone who does, like to go to the retail pharmacy, that's completely fine. You'll just pay 3 times the retail copayment, but you will need a 90-day prescription from your doctor in order to do that. They also have put in, and I think this is a nice feature, it's a split fill program available. So if you're someone who maybe you went to the doctor and you have a test round of medication, and before you would have to get a 30-day supply. Well, now Anthem has approved that they have a split fill program available. So if your doctor wants you to try it for 2 weeks, you can get a prescription for 2 weeks in order to take that test round of medication. So I think that's a really nice enhancement there. The vision, dental, life, and disability policies are renewing with Guardian. So no benefit changes from that standpoint. We're going to talk about pre-tax benefits for a second. The IRS has the Section 125 where your premiums are deducted from your pay on a pre- or after-tax basis. So pre-tax elections, those cannot be changed within the calendar year for which they are made unless you experience a mid-year qualifying event. This is where the insurance premiums are deducted from your gross pay before Medicare, federal, and state taxes are calculated, so it reduces your overall tax liability. I will tell you, if you're going into PlanSource to make any enrollments or changes, there is a pre-tax question on there. The default is that your PlanSource selection will be to pre-tax your elections, because that is the most typical election. So we don't want to confuse anybody on this, because 9 times out of 10, you're pre-taxing your benefits when it's available. There are some situations where the post-tax is a little bit better for them, for their particular situation. I don't see this very often, but you do have that option available to you. But just keep in mind, you know, your insurance premiums are deducted from your pay after taxes, so it doesn't reduce your overall tax liability. But if you have any questions on this, please contact your manager, and we can help you get through that question and see if that is an option that you need to consider. But again, 9 times out of 10, you're going to go with the pre-tax. Just a few healthcare reform reminders. This is nothing new. Qualifying young adults up to age 26 may come on the plan regardless of the child's marital, student, or tax-dependent status. The student can remain on your medical plan, or dependent, I should say, until the end of the month they turn 26. So this is not the end of the year in which they turn 26. This truly is after their 26th birthday, the end of that month, they would terminate off the program. And then preventive care is covered at 100%. That is not new. That's been going on for a while now. And I want to talk about preventive care just a little bit, because I think it's important for everyone to understand this has gotten a lot better. The providers are well aware of what the requirements are for things to be covered at 100%. But just so you are aware, when you go for your annual wellness visit, well child care is covered through age 6. That includes immunizations and screenings. Routine wellness services, age 7 and older, so that's your annual checkup visit. And then preventive care, 1 of each per plan year, the annual gynecological exam, pap test, mammography screening. Again, some of these are for age-appropriate situations, because the IRS actually dictates which services are covered at 100%, and the providers are just following those codes that the government has said have to be covered at 100%. So let me give an example. If you are someone who your doctor decides that you need to have a mammogram, but you haven't reached the age requirement that the government says it's covered at 100%, but perhaps there's a family history there of breast cancer, so they want you to start having mammograms early, that's not going to be covered at 100%. Because you have a medical reason that you're having that testing done. Okay, so that makes it no longer preventive. Another example would be when you reach the age to have a colonoscopy and they go in to do the colonoscopy, it is covered at 100%, but they find polyps. At that point in time, they're going to go ahead and remove those polyps, but then the service is no longer covered at 100%, because now we're tied to a medical diagnosis. So for things to be covered at 100%, it truly, truly has to be a preventive service. And this is a nice little diagram that outlines that. So preventive care, you have no symptoms or illness or history prompting the screening, and it is in accordance with age and gender guidelines. For diagnostic, the symptoms require further diagnosis. Previous abnormal tests result more testing or future screenings, and then, or you have to have rescreening. So again, that's kind of the differentiation between the preventive care and the diagnostic services. Okay, now we're going to talk about the medical plans. Again, these are effective on August 1st. The medical contributions, R&R will continue to contribute a flat $325 to each employee's full monthly medical premium. Below, the chart has the monthly and biweekly payroll deductions, and you'll see each plan has a column there. So there's the 2,000, the 1,000, and the 500 plan. And then you'll see your monthly deduction, and it goes employee, employee spouse, employee child, employee children, and employee family. And then under that, you'll see the actual biweekly, so what's coming out of your paycheck on a biweekly basis for each tier and each benefit. This whole presentation is going to be available to you within PlanSource Document Library. I've already loaded it on there. So if you need to refer to anything that we're talking about today, this is included in PlanSource already. Okay, the first plan we're going to talk about is the Healthkeepers Value Advantage 30-2030. Again, this is one of the programs that is already available today. None of these plans require referrals. So if you are needing to see a specialist, you do not have to go to your primary care doctor first to get a referral. You can just simply make an appointment with your specialist and go directly there. The plan accumulates on a calendar year basis, so just keep that in mind. This plan has an annual deductible of $2,000 for an individual, $4,000 for a family, and a maximum out-of-pocket of $6,000 for an individual and $12,000 for a family. I'm going to talk a little bit more about the out-of-pocket maximum and what that means in just a second. But the physician office visits are $30 copay for primary care, and then $50 copay for a specialist. Urgent care is a $50 copay. And then you'll see below that for any higher cost services, so emergency room, inpatient services, outpatient services, that's going to include outpatient surgery, diagnostic lab services, and then advanced diagnostic services. Advanced diagnostic services are going to refer to MRI, CT scans, PET scans. All of those items that I just listed are covered at 30% after the deductible. So you would meet that $2,000 deductible for those services, depending on, what the charges are, and then you'll pay 30% after that. Anthem will pay 70%. Keep in mind that these are up to your maximum out-of-pocket. So the maximum out-of-pocket is the most you're going to pay in the calendar year for your services. So if you have a really bad year, or perhaps you go in the hospital for an extended period of time, you're going to have a $6,000 maximum for an individual, or as a family, $12,000. So if you have 5 people in your family, the most your family is going to pay is $12,000, but no individual will go over $6,000. Okay, so you do have what's called a stop loss there. That's the most you're going to pay. If something really catastrophic happened. The Healthkeepers, this is a new plan, $21,000. You'll see the deductible is a little bit lower here. It's $1,000 for an individual and $2,000 for a family. And then the maximum out of pocket is $5,500 for an individual and $11,000 for a family. $20 and $40 for primary care and specialist, and then the urgent care is $40. The coinsurance is a little bit lower on this plan. So if you have the emergency room visit, the inpatient services, outpatient surgery for facility, the diagnostic labs, those are all coming in at 20% after deductible. So again, even though that maximum out of pocket is not vastly different from the $2,000 deductible plan, you'll notice that you're going to get there a little bit slower because your deductible is lower and your coinsurance is lower. Okay. And then lastly, we have the Healthkeepers point of service 20-2500. It has, this would be what we would consider your richest plan that's available to you. So if you are someone who really does not like a lot of exposure when you're paying deductibles and so on and so forth, and you'd rather pay a little bit more out of your paycheck, then you may want to consider this plan. It's a $500 individual deductible, $1,000 for a family, and then the maximum out of pocket is $4,500 for an individual and $9,000 for a family. The office visits are $20 and $40, and then a $40 urgent care copay. And then this plan also has the 20% after the deductible. However, you'll see for diagnostic lab services, it's just a $20 copay. You don't have the you don't have the coinsurance or deductible that would apply to diagnostic labs. You would still have that for your higher cost services on the diagnostic side, so the MRIs, the CT scans, those are still going to come at 20% after deductible, but if you had some lab services done in the provider's office, you would have a copay. All three of the plans have the same pharmacy benefit. It's $10 for generic drugs, $30 for Tier 2. Those are going to be your lower cost brand name drugs. $50 for Tier 3, those are going to be your higher cost brand name drugs. And then Tier 4 is going to come in at 20%. So you would pay 20% of the negotiated rate that Anthem has for that medication. These are going to be your really high cost drugs. So any kind of injectable or perhaps something for a cancer medication comes to mind. Enbrel, I want to say, may fall into Tier 4. There are certain medications that fall under Tier 4, but the rest would be just copays. We always like to go over out-of-network benefits because I like to differentiate kind of what this means. Yes, you do have some out-of-network benefits. I will tell you that Anthem Healthkeepers Network in Virginia is extremely robust. You have 95% of facilities, 92% of doctors. You should not have an issue finding an in-network provider. However, if you have a provider that maybe they don't take insurance, for whatever reason, they don't participate with Healthkeepers, but you really want to go to that provider, you do have some out-of-network benefit, but just know that on top of these separate costs, so it's a separate deductible, separate out-of-pocket maximum, so this is a totally separate bucket here, they can also balance bill you for the difference in what was billed versus what is reimbursed. So if you go to an out-of-network provider and they bill $100, but Anthem says, well, for this service, you know, usual and customary, we're going to say it's worth $50, and that's what we're going to reimburse, the provider can bill you for the $50 difference. So just want you to be aware of that if you do go out of the network. Okay, Live Health Online, I definitely wanted to point this out. I don't know if anyone has tried this yet, but Anthem rolled this out last year. They've had a lot of success with it. I have tried it. I thought it worked very well. You can see a doctor 24/7 with Live Health Online. You are basically, in essence, FaceTiming with the doctor. It's video, chat, or phone. You have a choice when you log in of your credentialed providers. This information, I want to say it's on the back of the ID card, or else it is just when you log into Anthem's website under your member login. You'll find information there as well on how to launch Live Health Online. But it's really nice if you have a minor situation going on, so a sinus infection, maybe an eye infection, something that you're pretty sure you know what the issue is, and you may just need a prescription and you don't want to have to wait in the waiting room and deal with all that hassle. So we've had people in our office, they just go in a private office or conference room and they FaceTime with the doctor and they leave with a prescription. And it's just the cost of a copay. It works really, really well. They also have available mental health services. It works a little bit different because it's not immediate, but you would initiate the appointment and then the provider will actually call you back. They'll set a scheduled appointment for you so that you'll actually have some more time to spend with them. But I think that's a great thing as well. Okay, some tips for stretching your dollar. Use in-network providers whenever possible. Opt for generic drugs over brand name. There are $4 generic drug offerings through Walmart, Target, CVS, Walgreens. They all have $4 drug listings, so you can get your medication for less than the $10 generic, and it doesn't even run through your insurance. You just go pay $4. There's a lot of antibiotics, just simple antibiotics that they have on those lists. A lot of low-cost maintenance medication. So I really encourage you to check that out. If you're on a maintenance medication, you can use the mail order. It'll come directly to your home, and you'll save copays there. And then limit your emergency room visits to true emergencies only. I always like to say that if you have a true emergency, we absolutely want you to go to the emergency room. But if it's a situation that could be taken care of at an urgent care facility or the primary care doctor, it's definitely better to go that route. The emergency room is the highest cost visit by far. You know, there's not a lot of discount between what the emergency room's bill and what Anthem's negotiated rate is. And when you're paying your deductible plus a co-insurance for a visit like that, you know, it can be very expensive. So you really want to limit that to a true emergency. Now we're going to talk about the voluntary products, dental, vision, and life insurance. We will continue the Guardian Voluntary Dental. It's an annual maximum of $1,500. Now, an annual maximum under dental is a little bit different. So under medical, when we talked about that out-of-pocket maximum, that was the most you were going to pay for your services. Under dental, the annual maximum is the most the carrier is going to pay for your services. So you do have a cap on how much Guardian is going to pay for your dental services in the year. You have an annual deductible of $50 per person or $150 family max. Now, if you go in for your preventive services, so cleanings, x-rays, fluoride, all of that is covered at 100%. So you don't have your deductible that you have to pay when you just go in for your preventive services at an in-network provider. For basic services, that's going to be fillings, extractions. Those are covered at 90% after your deductible. And then major services, so crowns, bridges, inlays, onlays, are covered at 60% after deductible. This program does not include orthodontics. You do have out-of-network benefit on the voluntary dental as well, but you'll see that your deductible is a little bit higher and the benefits are just not as rich, but you do have that option if you were to go out of the network. The Guardian Voluntary Vision Plan. The network is through VSP. It's a huge network. It's a national network. You have an exam available once every 12 months for a $10 copay. Lenses available once every 12 months for a $25 copay, and those are just standard lenses. I believe you can upgrade your lenses for other costs. Frames are available once every 24 months at $120 retail allowance. And then you can also elect to receive contact lenses in lieu of frames and lenses, and that also has a $120 retail allowance. The voluntary life insurance has a maximum benefit of $250,000. Just so you know, the benefit does reduce at age 65. And you have accidental death and dismemberment. It's a maximum of 1 times your life amount. If you did not elect voluntary life insurance when you were initially eligible, then you will have evidence of insurability required. What happens is if you're going to go into PlanSource and you do want to either elect voluntary life for the first time or you want to increase your voluntary life amount, you can absolutely do that on PlanSource. However, a form is going to pop up during your election. You have to print it off, complete it, and submit it to Guardian for approval. Once R&R receives the word that Guardian has approved it, that's when they will start taking premium out of your paycheck. So what happens is if you make that election now and you want to elect voluntary life, and maybe Guardian, you know, is a little backed up on their evidence of insurability reviews, so they don't actually approve it until August 15th, and the plan year started August 1st, they will make you effective on September 1st, and that's when your paycheck will start being deducted for the benefit. So you will not pay for anything until you are absolutely approved. The premium for voluntary life insurance is calculated through PlanSource because the rates are based on your age. So when you go through, you'll actually be able to see exactly what your benefit will be and how much it will cost based on, the system will actually calculate it based on your age. Okay, we have a couple of employer paid products to review. R&R does provide at no cost to you short and long-term disability. Short-term disability insurance is provided by Guardian. They will pay 60% of your base pay with a 15-day elimination period, and it's up to a $1,500 maximum weekly benefit. And again, these premiums are paid by R&R, so you're automatically enrolled in this benefit if you're eligible as a full-time employee. Long-term disability insurance is also available. So if you had a short-term disability situation and you ran through that benefit and you were still considered disabled, you would then fall into the long-term disability insurance. And Guardian does have a claims person that would work with you through this process. There's paperwork they need and provider information. Your doctor has to deem you disabled. But upon approval, they would pay 60% of your base pay with a 90-day elimination period. $5,000 is the maximum monthly benefit. So again, R&R does offer this to you. They pay this for you on your behalf. But the IRS actually considers benefits received from an employer-paid disability program as reportable income, so they're subject to federal income tax. Well, when you're out on disability and you're only getting 60% of your check, it would be a lot less, again, if you had to take taxes out of that. So what R&R does is they add the value of the premium to your paycheck, which is subject to taxes, then they deduct the cost of the coverage. So that allows you to pay the tax on the value of the premium, and then if you were to go out on claim, you're going to collect a tax-free benefit at point of claim. So this is a huge benefit that they do this for you, because if you were to go out on claim, you would not have your benefit taxed. Okay, we're going to talk about the flexible spending account. This is something that's been in place for a while. If you have never taken advantage of a flexible spending account and you have either medical expenses you know are coming up, or maybe you take a maintenance medication, or you're going to have some dental expenses this year, I would highly encourage you to consider this. You can elect up to $2,550 to reimburse yourself for qualified medical expenses. So what happens is they would, whatever your election is, so if you elected $100, $500, that amount is divided out into your paycheck to be deducted over the course of the plan year. And at any time, you can take out of your flexible spending account the full amount that you put into the account so that you could pay for copays, deductibles, so on and so forth. This is just a great benefit. You have to be careful because if you don't use it, you lose it. But your tax-free dollars are saved through payroll deductions. So the bottom line is you're setting aside money on a tax-free basis to pay for your qualified medical expenses. So just something to consider. And the other piece of this you need to know is this is a benefit you do have to re-enroll in every year because they need to know your elections, and we'll talk about that in just a second. Okay, we at Digital Benefit Advisors, we have what we call our Advanced Resolution Team, or ART. They are available to help you Monday through Friday from 8 a.m. to 5 p.m. They're available by phone or email, and they are really, their full-time job is to help just individuals with claims issues, billing issues. Maybe you had, a situation where you were inpatient and you're getting all of these bills and they're just not making any sense, and you're trying to figure out what you need to pay and how it's all working. These are the people that will help you. My recommendation would be to, if you can, collect your information and email it to them. We have a secure email, so you can email that to them and they will do the research for you, and then they will email you back. It's usually within 24 to 48 hours that you would get a response, or you're absolutely welcome to give them a call. Okay, so here's some housekeeping items and what you need to do next. So PlanSource is open, and it's going to be open through July 8th for employees to enroll, make changes, or decline the group benefits. If you are not making any election changes, you are not required to actively re-enroll. The only thing you will have to do is sign the memo acknowledgement that Jonathan sent out to everyone. So if you want to stay in the same medical plan, the same dental plan, you're not going to do the flexible spending, you actually do not have to go into Plan Source at all. But if you are going to make any changes, maybe you just want to look and see what you have today, and maybe you want to increase your voluntary life insurance. All of that would require you to go back into Plan Source to enroll. All of the passwords have been reset to the employee birth date. So it's year, month, and date format. So it's the full year, a 2-digit month, and a two-digit date format. And while you're in Plan Source, please confirm all your information is correct. So your dependent information, any addresses, phone numbers, etc. And then lastly, only employees making changes will receive a new ID card from Anthem. I think historically, everyone has always gotten new ID cards. That happens when Anthem is making some changes to their ID cards, but this year nothing is changing. So only the employees that are making changes will receive a new ID card. Okay, so I want to open it up now. If you have any questions, again, you can type them in the chat, and I will repeat the question and then hopefully answer it for you. If I can't answer it, I will find out and let you know. Okay, the question is, when does the current plan end? This plan is going to end on July 31st, 2016. So our new plan year will start on August 1st, 2016. That's correct. So the flexible spending is good until July 31st. Yes, that is correct. And I will double check on this, but you actually should have a grace period not to incur expenses. So you can only incur your expenses until July 31st, I believe. I will double check on this. But you should be able to have a little bit of a grace period to submit your receipts if you need a little more time, but I will double check on that. Why is there a drastic increase from one child to children? This is the same as last year. They just, it's basically the carriers, they assume that an additional person on the plan is just going to cost more than having 2 people on the program. So anytime you have more than 2 people, it's just going to be a higher cost to add additional folks onto the plan. Okay, any other questions? I'm not seeing anything else come through. We will also be posting, in addition to the PowerPoint presentation that's in the document library, you will also find plan information out in the document library. And we'll also have a link to this webinar recorded. So you'll be able to watch that again if you want to go back and see any information as well. And Angela and Jonathan, they all have my information, Bill. So if anybody has any additional questions, please feel free to reach out to them, and they know where to find me, and I will help in any way I can. Or even if you just need help deciding on a plan, or you're trying to decide between 2 plans, I am happy to help you kind of go through that and try to figure out which one's best for you. But I really appreciate you all attending today, and I hope you have a great day. Thank you so much.